Before you start using Humira, CF, pen Pediatric Ulcer Colitis Starter 80 mg per 0.8 ml Subcut Kit Inflammatory Bowel Agents, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional and the product package. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, let your doctor know. Remember that the benefits of this medication outweigh the potential side effects. Notify your doctor if you develop signs of infection or experience serious side effects, such as heart-related symptoms, blood in the stools, mental/mood changes, vision changes, or a butterfly-shaped rash on the nose and cheeks. Adalimumab may rarely cause liver disease, so your doctor may order blood tests and monitor for symptoms. Contact your doctor immediately if you have any symptoms of liver damage or experience a serious allergic reaction. This is not a complete list of possible side effects, so if you notice anything concerning, it's important to discuss it with your doctor. Before starting Humira, make sure to inform your doctor or pharmacist about any allergies you may have, as this product could contain inactive ingredients that may cause allergic reactions. Also, share your medical history with your healthcare professional, especially if you have had recent infections, blood or bone marrow problems, or certain brain or nerve disorders. It's important to be cautious around anyone with infections that can easily spread, and to avoid contact with people who have recently received live vaccines. You should also take care to avoid getting cut, bruised, or injured, and to use caution with sharp objects and during activities such as contact sports. If you are an older adult, you may be at greater risk for infections and cancer while using this medication. And if you are pregnant or breastfeeding, be sure to discuss the risks and benefits with your doctor before using Humira. It's important to be aware of potential drug interactions when taking Humira. Certain medications may affect how Humira works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Humira include other TNF blockers like etanercept and infliximab, as well as other drugs that weaken the immune system such as abatacept and anakinra. If someone has taken too much Humira and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important not to share this medication with others. Your doctor may also schedule lab and/or medical tests, such as complete blood count and liver function tests, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing Humira, cf. Pen Pediatric Ulcer Colitis Starter 80 mg per 0.8 ml Subcut Kit Inflammatory Bowel Agents, it's important to keep it in the refrigerator, but be careful not to freeze it. Some brands may be stored at room temperature, so it's best to check with your pharmacist or read the product package for specific instructions. Once the medication has been at room temperature, it should not be put back in the refrigerator. It's important to keep the medication in its original container to protect it from light. Any unused portion of the medication should be discarded, and it's important to keep all medications away from children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. Instead, it's best to properly discard the product and it is expired or no longer needed. It's a good idea to consult with your pharmacist or local waste disposal company for the best way to dispose of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.